Q1. General guidance for the storage of controlled drugs should include the following except: cupboards must be kept locked when not in use. Keys must only be available to authorized member of staff. Regular drugs can also be stored in the controlled drug storage. The cupboard must be dedicated to the storage of controlled drugs. Q2. A patient recently admitted to hospital, requesting to self-administer the medication, has been assessed for suitability at level 2. This means that the registrant is responsible for the safe storage of the medicinal products and the supervision of the administration process, ensuring the patient understands the medicinal product being administered. The patient accepts full responsibility for the storage and administration of the medicinal products. None of the above. The registrant is responsible for the safe storage of the medicinal products. At administration time, the patient will ask the registrant to open the cabinet or locker. The patient will then self-administer the medication under the supervision of the registrant. Q3. You are on your medication rounds and the emergency alarm goes off. What will you do first? Lock your trolley. Rush to your patient's bedroom. Check first if everyone had their meds. ANC. Q4. All but one describes holistic care, a system of comprehensive or total patient care that considers the physical, emotional, social, economic, and spiritual needs of the person, his or her response to illness, and the effect of the illness on the ability to meet self-care needs. It embraces all nursing practice that has enhancement of healing the whole person from birth to death as its goals. And all nursing practice that has healing the person as its goal. It involves understanding the individual as a unitary whole in mutual process with the environment. Q5. What are the most common types of medication error? Nurses being interrupted when completing their drug rounds, different drugs being packaged similarly and stored in the same place, and calculation errors. Unsafe handling and poor aseptic technique. Doctors not prescribing correctly and poor communication with the multidisciplinary team. Administration of the wrong drug, in the wrong amount to the wrong patient, via the wrong route. Q6. None of the following is not true about a delegation responsibility of a medication registrant. Nurses are accountable to ensure that the patient, carer, or care assistant is competent to carry out the task. Nurses can delegate medication administration to student nurses on supervision. Nurses can delegate medication administration to unregistered practitioners to assist in ingestion or application of the medicinal product. All of the above. Q7. Who has the overall responsibility for the safe and appropriate management of controlled drugs within the clinical area? All registered nurses. The nurse in charge. The consultant. All staff. Please like and subscribe. Q8. Mark is prescribed Lanoxin 500 micrograms PO. What vital sign will you assess prior to giving the drug? Heart rate and rhythm. Respiration rate and depth. Temperature. Urine output. Q9. Independent and supplementary nurse and midwife are those who are nurse and midwife student who cleared medication administration exam. Nurses and midwives educated in appropriate medication prescription for certain pharmaceuticals. Registrants completed a program to prescribe under Community Nurse Practitioners Drug Formulary. Nurses and midwives whose name is entered in the register. Q10. You were running a shift and a pack of controlled drugs were delivered by the chemist/pharmacist whilst you were giving the morning medications. What would you do first? Keep the controlled drugs in the trolley first, then store it after you have done morning drugs. Count the controlled drugs, store them in controlled drug cabinet and record them on the controlled drug book. Count the controlled drugs, store them in the medication trolley and record them on the controlled drug book. Record them in the controlled drug book and delegate one of the carers to store them in the controlled drug cabinet. Q11. A patient approached you to give his medications now, but you are unable to give the medicine. What is your initial action? Inform the doctor. Inform your team leader. Inform the pharmacist. Routinely document meds not given. Q12. As a RN, when you are administering medication, you made an error. Taking health and safety of the patient into consideration, what is your action? Call the prescriber. Report through yellow card scheme and document it in patient notes. Let the next of kin know about this and document it. Document this in patient notes and inform the line manager. Assess for potential harm to client, inform the line manager and prescriber and document in patient notes. Please like and subscribe. Q13. Patient has next dose of digoxin but has a CR equals 58 emit dose, record Y, and inform the doctor. Give dose and tell the doctor. Give dose as prescribed. Q14. In caring for a patient, the nurse should, whenever possible, provide care that is culturally sensitive and according to patient's preference. Ask the patient and their family about their culture. Be aware of the patient's culture. Disregard the patient's culture. Q15. What are the professional responsibilities of the qualified nurse in medicines management? Making sure that the group of patients that they are caring for receive their medications on time. If they are not competent to administer intravenous medications, they should ask a competent nursing colleague to do so on their behalf. The safe handling and administration of all medicines to patients in their care. This includes making sure that patients understand the medicines they are taking, the reason they are taking them, and the likely side effects. Making sure they know the names, actions, doses, and side effects of all the medications used in their area of clinical practice. To liaise closely with pharmacy so that their knowledge is kept up to date. Q16. You are on a night shift in a ward and has been allocated to dispose controlled medications. Which of the following is correct? Controlled drugs destruction and pharmacy stock check should be done at different times. Controlled drugs should be destroyed with the use of the denaturing kit. Excessive quantities of controlled drugs can be stored in the cupboard whilst waiting for destruction. None of the above. Q17. As a newly qualified nurse, what would you do if a patient vomits when taking or immediately after taking tablets? Comfort the patient, check to see if they have vomited the tablets, ask the doctor to prescribe something different as these obviously don't agree with the patient. Check to see if the patient has vomited the tablets. If so, document this on the prescription chart. If possible, the drugs may be given again after the administration of antiemetics or when the patient no longer feels nauseous. It may be necessary to discuss an alternative route of administration with the doctor. In the future, administer antiemetics prior to administration of all tablets. Discuss with pharmacy the availability of medication in a liquid form or hide the tablets in food to take the taste away. Q18. Nursing process is best illustrated as patient with medical diagnosis, task-oriented care, individualized approach to care, all of the above. Q19. In a nursing and residential home setting, how will you manage your time and prioritize patients' needs whilst doing your medication rounds in the morning? Start administering medications from the patient nearest to the treatment room. Start administering medications to patients who are in the dining room, as this is where most of them are for breakfast. Check the list of patients and identify the ones who have diabetes mellitus and Parkinson's disease. All of the above. Q20. You noticed that a colleague committed a medication administration error. Which should be done in this situation? You should provide a written statement and also complete a trust incident form. You should inform the doctor. You should report this immediately to the nurse in charge. You should inform the patient. Q21. After having done your medication rounds, you have realized that your patient has experienced the adverse effect of the drug. What will be your initial intervention? You must do the physical observations and notify the general practitioner. You must ring the general practitioner and request for a home visit. You must administer medication from the Homely Remedy Pod after having spoken to the general practitioner. You must observe your patient until the general practitioner arrives at your nursing home. Q22. Which of the following descriptors is most appropriate to use when stating the problem part of nursing diagnosis? Oxygenation saturation 93%. Output 500 milliliters in 8 hours. Anxiety. Grimacing. Please like and subscribe. Q23. What is comprehensive nursing assessment? It provides the foundation for care that enables individuals to gain greater control over their lives and enhance their health status. An in-depth assessment of the patient's health status, physical examination, risk factors, psychological and social aspects of the patient's health that usually takes place on admission or transfer to a hospital or healthcare agency. An assessment of a specific condition, problem, identified risks, or assessment of care, for example, continence assessment, nutritional assessment, neurological assessment following a head injury, assessment for daycare, outpatient consultation for a specific condition. It is a continuous assessment of the patient's health status accompanied by monitoring and observation of specific problems identified. Q24. Which of the following items of subjective client data would be documented in the medical record by the nurse? Client's face is pale. Cervical lymph nodes are palpable. Nursing assistant reports client refused lunch. Client feel nauseated. Q25. When do you plan a discharge? 24 hours within admission. 72 hours within admission. 48 hours within admission. 12 hours within admission. Q26. The Mars says that Benedict is on TID macrogol. You have noticed that the nurses have been writing A for refused. What do you do? Write A on the Mars, because Benedict is expected to refuse it. Offer the macrogol, and write A if the patient refuses it. Check bowel charts and cancel macrogol on Mars if bowels are fine. Change the prescription to PRN. Please like and subscribe.